Hi everyone, my name is Stephanie Trong and I'm the current PGY2 in Pharmacy Administration, and today we're at the UC San Diego Health Encinitas Cancer Infusion Center, and we have here today with us Dr. Shayna Block, who is one of the pharmacist leads in the oral chemotherapy program. So we're going to ask you a series of questions, if that's okay, just so that we can learn about this amazing program that's offered here for our patients. So Shayna, can you start off by kind of going over what are the role of the pharmacist and what the oral chemotherapy program is?
Sure. So the oral chemotherapy program started in about October 2017. One of the physicians here had went to the annual ASCO meeting, which is the American Society of Clinical Oncology, in June, and there was a paper there where they did some work at Memorial Sloan Kettering, and what they did is they looked at, they gave their patients an electronic survey to try to tease out, are they having problems with their oral chemotherapy, are they able to stay compliant with it, and then if there was a problem, that was then routed to nurses or nurse practitioners or physician's assistants to kind of get a jump start on things, as opposed to waiting until the next physician visit if the patient didn't call in between to say they were having issues. So based on their work, they found that there was an overall survival advantage to doing just this short 12-question electronic survey. It was 31 months in the group that had the intervention. It was 26 months median overall survival in the other group. Oh, wow. So they had about 5 months difference, which was pretty cool with something that easy. So our physician came back and kind of wanted to do something similar to that here, and we didn't really have the resources to do the electronic survey, so we decided that the pharmacist would get involved, and we would contact the patient after they started new medication, and we would kind of interview them and ask them, a series of questions and make sure they're compliant, see if they have any side effects, if there's things we can address beforehand to keep them on the medication and on the medication appropriately. Mm-hmm. So what the program includes is we started out with just one of our physicians, the one who had the idea, and we have about 4 main physicians up here in Encinitas. We do see patients from Moores, but we have 4 main physicians. So we started out with one of those physicians, and I was the pharmacist and another pharmacist were calling the patients and taking turns. And we started off with about 5 patients that we were following, and if there was an issue, what we did was we would offer them ways to, alleviate that side effect, or we would then route it to the nurse practitioner and say, hey, I think this is a little bit out of our scope. You might want to give the patient a call and see what's going on and see if you need to bring them in or if you can just help them over the phone. Mm-hmm. So that's kind of where we started, and we've kind of been doing that. We had some staffing issues, so that's why we're not quite as far along as we wish we would be at this point. Mm-hmm.
That's great. So it looks like, you route it to the nurse practitioners and nurses, and then they kind of take the lead on managing their component. Is there collaboration with physicians also in terms of, can you kind of discuss about that?
So the whole group meets about monthly, and the group consists of pharmacists, our physicians. It has our nurse practitioner, who's kind of the main point person for the program. It has our nurse case managers, who are the ones that kind of are giving us the information that the patient's starting oral chemotherapy and that they should be enrolled in the program. So it's very multidisciplinary in terms of the group that we're working with. And like I said, we make the phone call. We follow the patients weekly at first, then every 2 weeks, then monthly thereafter, as long as they're not having any issues. And if we need to involve the nurse case manager because of a side effect, we'll involve them, or not the nurse case manager, the nurse practitioner because of a side effect, we'll involve them. And then any notes that I write up, I route them to that team. So if whoever patient it is, I route it to the doctor, the nurse practitioner, and the nurse case manager. So they kind of see like, hey, how's the patient doing? And then the doctor can intervene if they say, oh, I'd actually like him to rather, do this instead, or that sounds good, I agree with that. Mm-hmm. So he's involved the whole way.
That's great. Are pharmacists involved with any prior authorization related to the medications?
That's a great question. So yeah, we do have a retail pharmacy up here, and what we do is all of our prescriptions try to go to that retail pharmacy and be filled there. If they can't be filled there, then we try to send it to the Moore specialty pharmacy, or if it has to go outside, it has to go outside. But those pharmacists that work in our retail pharmacy also help out with prior authorizations for all of our physicians. Mm-hmm. So it's really all of us are working together, and that pharmacist's also letting me know, like, hey, the patient picked up the prescription, you know, I did the initial counsel, and I also include her in all of the notes that I'm sending out.
That's great. The next question I have is, has there been any feedback provided by either the healthcare team or just any patients that you've interacted with?
Yeah. So we were talking about doing a survey to actually get more feedback. The patients, whenever I call them, they're all open to talking to me. I haven't had one say, like, I don't want to be contacted, or please don't call me. And we have made a lot of interventions. So there's been patients who've been taking the drug incorrectly that we were able to, you know, talk to them before, you know, a month or two goes by, and then they actually see the physician and realize they've been taking it incorrectly, or we've been able to combat some symptoms earlier. So there's been a lot of benefit, I think, from the program.
Great. Do you see kind of any future plans and just kind of growth with the program itself?
So the next step, we just had one physician. We just added another physician of our 4 up here, and our goal is to ultimately, probably over the next couple months, is to add on our other 2 physicians, so that we're following all of our physicians up here. If this program goes well, and we'll do like patient satisfaction surveys and get more information and data points, I really would envision it kind of going to the whole system and maybe going down to Moore's. And following all of our patients that we have at UCSD, not just the ones in North County.
Great. Well, that's all the questions I had for you, and I want to thank Dr. Sheena Block very much for her time today.